Secondary cancers are one of the side effects that's known to be connected to treatment of Hodgkin's lymphoma. And I am in the hospital today. I had some operations last night to remove my left breast because I was diagnosed with breast cancer on April 27th, 2016. It seems like I'm getting another cancer a little too soon after my treatment for Hodgkin's. I knew it was a possibility, but I thought it would be farther down the road. Instead, it was now. So make sure if you go through chemo that you're really on top of getting those checkups. For me, I've always done self-examinations once a month, and when I was on ABVD for the Hodgkin's, I went into perimenopause and my breasts both became quite tender. So after I was done with chemo, I wanted to make sure that everything was okay. I went in to get a mammogram and it popped up. Now, it wasn't there in January when I had the PET scan, and it is known as ductal carcinoma in situ. It's very common out of cancers, unlike Hodgkin's. And yeah, I'm glad I went in for the mammogram because I couldn't feel it at all. I have kind of lumpy breasts anyway, but with the dense breast tissue that I had, it probably would have been impossible to find it with self-checks until it was a lot further along, and fortunately we caught it really, really early. And I wanted to do a lumpectomy, but after the MRI for my breasts, my surgeon, Dr. Tittenzer, she looked at the results and said that it would be better just to take the whole breast. So they took the breast, and right before they do that, I went in and they injected me with some radioactive isotopes that kind of show where everything is inside the breast, and they traced out to some of the sentinel lymph nodes. And I got those, hi Caesar, I got those lymph nodes removed, and the good news is I don't have to do chemo again. Wednesday I did genetic testing, and I should get the results back in about 3 weeks for that, just in time for my birthday. So I'm doing pretty good now. Last night after the surgery, apparently one of my veins started to just drip blood on the inside. So after I ate dinner and drank water and everything, I had to go back into surgery to open it up and get that vein from stop bleeding. So it was cauterized, and then when I woke up the second time, my pain was a lot more, but I'm happy to know that I'm not going to have to do chemo again, at least not anytime soon. And I'm doing pretty good today. My throat's obviously ragged from the breathing tube, and you can see I've got irritation around my mouth because the breathing tube that they put in caused an allergic reaction, which is pretty typical for me. I know I've had friends and coworkers with breast cancer, and they've had reconstruction done. I won't be getting any reconstruction done for a number of reasons. One of them is, if you know about reconstruction, they stick an expander behind the pectoral muscle, and that's where the implant goes. And from reading on blogs and some other discussion sites for survivors of breast cancer, they said that it can cause some restriction of movement and things like that, and So I value my ability to move around and my nerves, and I value the less recovery time and less likely to have to go in and do further surgeries. So anyhow, that's what's going on with me. I've been busy for the past month with doing testing, and maxed out my insurance again this year. But everything's pretty good. I mean, I'm healing up. It seems pretty well. The pain's not too horrible. And I've got 2 weeks recovery, and then I'll be able to start going back to work again. Anyway, I really didn't expect this to come on. It was quite surprising. And hopefully this is the last time I have to deal with cancer. We'll see. But I'm feeling pretty good about it. And, yeah. Side effects from chemo. One of the ones is of course, like I said, further cancers. I've also been dealing with some achy pain ever since I finished chemotherapy. Tiredness, I'm still tired a lot. And of course, right now after surgery, I'm very tired. But, yeah. Anyhow, no worries. They caught it early. And I hope to be back on my feet and walking around normal once I'm off of these painkillers that they're giving me. And I get to go home today, which is awesome. Yeah. In the meantime, they're making me more cyborg than ever. So in addition to the port that I have up here, I now also have a drain that is there to collect the fluid out of my body, which looks a little bit like a clear hand grenade filled with watery blood. Yeah. Anyhow, hopefully I'll be able to see more of my family and friends later on in the year. And, yeah, doing well.